Hello and welcome everyone to the first installment of the Dairy Technology Tuesday webinar series hosted by Cornell Cooperative Extension Statewide Dairy Specialists and Cornell Pro Dairy. My name is Margaret Quasdorf and I work as a dairy management specialist for the CCE Northwest New York team. I'd first like to thank our sponsors today, whom you've seen in the slides leading up to the presentation. With their generous support, we are able to bring this program to you at no cost. So thank you to them. As a reminder, please use the chat box to share your comments or if you need any assistance. While questions for our presenter should go in the Q&A box, where my colleague Caitlin will be monitoring and helping us to answer those later on. Recordings of these presentations will be available on February 28th on the Pro Dairy page in our YouTube channels. So if you'd like to view, rewatch, or share, that's where you'll go to get those. And now I would like to introduce our speaker for today, Dr. Julio Giordano, whose research and applied programs focus on developing new and simplifying established reproductive technologies and herd health monitoring technologies. So I think we can see Julio's screen. I can see Julio's screen. Julio, I think we can hear you if you speak, please.
Hello.
Yes, we can. All right, with that, please go ahead and begin the presentation. Thank you.
Great. Thanks a lot, Margaret, and good morning, good afternoon, or good evening to everyone, wherever you are out in the world or whenever you're going to be watching this presentation. I would like to start by thanking the organizing committee and Margaret for having me give this presentation. And basically what I prepare for today is a talk on how do we integrate automated monitoring technologies for herd health and reproductive management. And I'll focus a little bit more on herd health, and hopefully we'll have time to discuss aspects of repro management as well. But just to give you an idea of what I expect to cover today, so I'll very briefly touch on what these automated health monitoring systems are. I'm sure that most of you are quite familiar, give you an idea of how they work. So basically, what kind of data do they use to help with health monitoring and management. I'll then discuss briefly and very briefly, because we as well as others have generated a lot of data for this field in the last few years on what do we know from research with these automated health monitoring systems. And I'll touch on three key areas that are things that are important to be aware of or understand as we then think on what can we do. So what do we do with these automated monitoring technologies in day-to-day management of dairy herds? So basically, how do we integrate these automated health monitoring systems into day-to-day management? So I'll try to build my case as to why, I'll give you our idea of how these technologies can be used. And again, hoping to have some time to talk a little bit more too about heat detection. So automated monitoring systems have been out there for a while now, and we have pretty much every day a new system coming out. So the industry, has different systems to choose from, and I'll refer to the ones that we have used a little more in our research, but recognize that there are many others out there as well. Most of these systems work with sensor tags. And we have wearable and non-wearable sensors. And among the tags that go on cows, we have the ones that can be attached to legs, ears, necks of cows, as well as the ones that go intraruminally. And then we have also a variety of non-wearable sensors. Those are going to be the ones that don't go on or inside the cow. So they're somewhere in the cow environment and generate data about these cows, the environment in which cows are, or the way that cows are managed at a farm. But the thing that most of these technologies have in common is that they monitor one or more behavioral, physiological and performance parameters from cows. So basically, they monitor parameters that can tell us something about the health or the reproductive status of cows. And we have a number of those parameters today. I'm going to be talking in more detail about some of those, but some of the most common include physical activity, rumination time or rumination behavior, body temperature, and milk production. So these are some of the most commonly used today by a lot of the different systems that are out there, but of course there are some other ones. And for most of the systems, so they generate, again, a lot of data about the health and reproductive status of cows, but then that data, that information has to be or is converted to some form of actionable alert. And there are a lot of differences across different systems out there in the industry, but several of them and more of them today, what they basically do is interpret this data. So the systems learn to interpret changes in pattern of the data or absolute values with this data. And that is converted then into actionable alerts, basically alerts for health status of cows, alerts for estrus. So basically they tell farm personnel that cows need attention. And that may be in the case of health alerts because the cow might be sick. So the cow may be undergoing a health disorder. In the case of repro is because the cow may be in estrus. So these actionable alerts are transferred to different types of software, such as the dairy herd management software, the own system software. They are sent to personnel in the form of emails, text messages. There are many forms in which this information is delivered to users. But again, in general, the point is that cows need to wear the sensor tag. So we have these sensors in the cow environment. We collect data about these one or more of these multiple behavioral, physiological, and performance parameters that tells us something about cows. And then that information has to be translated into some form of actionable alerts. Of course, it is absolutely possible to use this raw data, to use the actual values from these parameters in the form of absolute values, relative changes, or changes in the patterns, as I'll discuss today. So what I hope to finish with today is, so how do we integrate, again, so how do we make use of these technologies, whether we already have them, like some farms may have them already, or farms that are considering the use of these technologies on farm. So in order to think or to figure out ways to implement these technologies, there are a number of questions that we have to ask ourselves and try to answer as we try to think how to integrate these technologies. And we have approached them from a research perspective, but most of them have very important or have practical implications that I'll try to emphasize today. One of those first questions is, do the monitor parameters, so do the sensor monitor parameters change when cows are affected by health disorders, right? So are there true changes in these parameters that can help us identify cows with health disorders? Which take us to the next question, that is, can these systems actually identify those cows of interest? So basically cows that are affected by clinical health disorders, and we want to or need to identify to implement the treatment or management strategy or intervention that will help that cow deal with that clinical health disorder. If cows are actually identified, the next question is when. So when in relationship to the case of clinical disease, it's not the same if cows are identified at a reasonable time around clinical disease than if it is way too late, or it is probably, as could be in some cases, a little too early. And last but not least, and a very critical one, is what happens to herd performance, outcomes, when we try to implement a program that relies primarily or even possible exclusively on the use of alerts or data from this automated system. So what if a dairy decides to implement a health monitoring and management program based on this technology? What will be the consequences for herd performance outcomes? So will it work? Will we have some issues associated with running programs this way? So I'll try to answer these questions one at a time. And I'll just briefly touch on the concepts, and then I'll show you very briefly some of the data we have generated for this. So to the first question of do sensor monitor parameters change when cows are affected by clinical health disorders? So basically, the question is this. So if day 0 is when a cow is diagnosed with a clinical health disorder, do we actually see a drop, or in the opposite case, for a parameter that goes up, do we see an increase in the parameter of interest, or does the parameter remain unchanged, right? And of course, in order to have these technologies be successful, there has to be a change, right? There has to be a change as dramatic as possible for the parameter of interest in order to be able to identify cows. So I'll leave you with the message first, and then I'll show you the data. So what we have learned in recent years through research is that most sensor monitor parameters do change when cows are affected by clinical health disorders. We have also learned that the same disease, and these are all things that are expected, of course, cause changes to more than one of the parameters that we can monitor today with sensors. So there may be a change in more than one parameter. Of course, this is disease dependent. And also, and important, different diseases, different health disorders cause different changes to sensor monitor parameters. So again, most sensor parameters change when cows are affected by health disorders. The same disorder will cause a change in more than one of these sensor monitor parameters, and it will depend on what we are able to measure with the system that we have on farm. And then when we look at different diseases, they cause different types of changes to these parameters. So I'll give you just one example for each one of these concepts. And I'll use certain diseases and certain data from experiments that we have done. So this is just the example of cows affected by displaced abomasum, so by DA. 3 different studies using 2 different sensor neck tags or an ear attached sensor. And in green, you have cows that were not affected by any health disorder. And in red, you have the pattern of rumination time. So this is rumination for cows that were affected by DA. And day 0 is the day of clinical diagnosis of DA. And what you should appreciate here is that in the 3 figures, the red line shows a different pattern than the green line, which means that in every case, cows affected by DA had a different pattern of rumination time than cows not affected by DA or any other health disorder at the same range of days in milk. So cows with DAs had changes in rumination time. The other concept is that cows with a particular disease, in this case metritis, present typically changes in more than one of these parameters that we can monitor with sensors. So this is the case of metritis, and cows with metritis present alter or changes in their pattern of rumination behavior, eating behavior, and reticuloruminal temperature. Again, this is something that we have known for a long time, that all these changes happen. The difference that today we can monitor this in real time with these automated sensors. Of course, the magnitude and the timing of the changes depend on the sensor. So rumination has a certain pattern in cows with metritis that is different than for eating behavior or the pattern of reticuloruminal temperature. And this has important implications for practical use. And the last point or last concept is that different disorders, in this case, I'm giving you the example of DA and metritis, cause different alterations to the pattern of different sensor parameters. So in this case, you can see cows affected by the A, and this is what I have already shown you. And the point is, look at the difference between the red line here and the yellow line. So the pattern of rumination behavior in cows affected by the A was not the same as for cows affected by metritis. The same is for reticular ruminal temperature. The pattern of temperature in relationship to clinical diagnosis of the A and metritis was not the same. The timing of the changes, the magnitude of the changes were different for cows affected by the A than for cows affected by metritis. So these are important messages that help us understand some of the things that we have observed when we try to use these technologies to identify cows with health disorders. Another interesting finding and concept from our research is the following. And this is also something that makes a lot of sense, and probably a lot of you that have experience with these technologies have also noticed, but this is also important for practical application. For most disorders, in particular when there is a range of severity, so when cows present different levels of severity of the disorder, there is typically a correlation between the severity of the disorder and the degree of change of the sensor monitor parameter or parameters. And this is what I'm trying to exemplify here with this chart of, the level of severity. So less severe cases will, present more moderate or milder changes in the pattern of the parameter around clinical diagnosis, as opposed to more severe cases of the disorder that will lead to much greater, much bigger changes in the parameters of interest. This is exactly the same that happens when cows are affected by more than one disorder at the same time or within a small window of time. So when a cow, for example, at the same time has metritis and clinical ketosis, or a cow that starts with a case of clinical ketosis and 2 or 3 days later the cow has metritis or DA or clinical mastitis, whatever it is. Same scenario. We typically observe much greater changes, and this makes sense, right? I mean, the cow is affected by more than one health disorder, so you see much greater changes in the pattern of the parameter of interest. So one example, once again, here, mastitis. So cows in blue are going to be those not affected by mastitis or any clinical health disorder. Cows in red are going to be cows that had mastitis and did not have what we consider to be a more severe case. So a case in which there were not only signs in the milk, but there were also mild. So when there are only changes in the milk or the other, versus in yellow are going to be cows that have systemic signs. So they have more severe cases. They present systemic signs such as depression, being off feed, and so on. So rumination time. Again, cows in yellow, the ones that had more severe cases, presented a lot more dramatic changes in rumination time than cows affected by milder cases or did not have systemic signs, which are represented in red. And those cows behave a lot more like cows not affected by health disorders and quite different from those with the systemic or more severe cases. So that's rumination time. You look at physical activity, is the same pattern. Cows affected by more severe cases of mastitis had more dramatic changes, more dramatic reductions in physical activity than cows without systemic signs. And to show you a parameter that instead of going down, it goes up, lying behavior. In this case, for our study, those cows affected by a systemic case, they had an increase in lying time, which was different from both cows not affected by health disorders and cows affected by a mild case of mastitis or without systemic signs of mastitis. Again, just to help me make the point that the more severe the case of a clinical disorder, the more likely that a cow or cows will have more dramatic changes in the parameters monitored by sensors. This is also obvious when we look at data in a little bit of a different way. So, and this is quite interesting from the perspective of using these technologies on farm. So we have been looking a lot at what we call the relative changes on the days prior to clinical diagnosis. So basically, we calculate the drop or the increase in the parameter of interest from a few days, let's say 5 days before diagnosis, to the day of clinical diagnosis. And to continue with the example of mastitis, so here we have in green cows not affected by mastitis or any other disorder, cows without systemic signs, and then cows in this case, and these are actually cows with mastitis only and no systemic signs. And then cows with mastitis plus another health disorder. So this is the other case that I was talking about earlier. And here you have rumination time, physical activity, lying time, and milk yield. And what I would like you to appreciate is the degree of change, the degree of relative change for cows not affected, cows affected by mastitis only, and finally cows affected by mastitis plus another health disorder. And I'm not going to review the numbers. The point is that cows affected by more than just mastitis had much greater changes in rumination times than cows affected by mastitis only. Physical activity is an example of one that did not change a lot more dramatically. Lying time, almost twice as much of a change for cows affected by mastitis plus another health disorder. And of course, milk production affected quite dramatically. And I would like also you to appreciate how these relative changes may be an interesting way to use data from these sensor parameters to identify cows with health disorders. And if you appreciate here the difference between cows affected by disorders versus cows not affected by disorders, you see how in the case of those parameters that go down when cows are affected, the values are always negative, whereas for healthy cows, the values are going up. So these are healthy cows in the same range of days in milk, and the values are going up. For cows affected on average, of course, there is variation around this average. The values go negative for rumination, for physical activity and milk production, and lying time, the values go up. So again, again, to give you an example of how the degree of change in the pattern of these parameters is associated with the severity of the disorder, or when cows have more than one health disorder at the same time or within a short period of time. Now to the second question. So do these automated systems have the ability to identify cows with health disorders? And if they do, when does that happen in relationship to the timing of clinical diagnosis with other methods? So I'm going to show you very briefly data from a study that we have done now a few years ago, and then I'll show you data from a more recent study. But we have learned that, for example, with a system that uses a combination of rumination and physical activity to generate this health alert called health index score or health ID score, that, for example, this particular system was quite effective at identifying cows with metabolic and digestive disorders, so displaced abomasum, clinical ketosis, and indigestion. So the range was anywhere from 89 to 98% of the cows had an alert within a 7-day window of clinical diagnosis, for an average of 93% for all these metabolic and digestive disorders combined. And as far as timing, on average for all the disorders combined was roughly 2 days. So 2 days before clinical diagnosis by traditional methods, cows already had an alert from this particular automated health monitoring system. Of course, there was quite a bit of variation, with some cows having it a few more days earlier than 2, and some cows having it on the same day or slightly later than the other system. than the other method to detect cows. So the point is, and this is just one example, quite effective, this particular system to identify cows with metabolic and digestive disorder, some variation depending on the disorder. This is important to recognize, and a reasonable timing in relationship to clinical diagnosis by other methods. We observe a little bit of a different story for cases of metritis. About a little bit over half of the cows had alerts. And in this case, and here is a great example of what I was talking about. You see the correlation between cows being affected by one type of disorder only, and maybe one that doesn't cause very dramatic changes in rumination time and physical activity, versus being affected by more than one health disorder. So you see how cows affected by metritis only about half of them had an alert, whereas cows affected by metritis plus another health disorder, about almost 80% of them did have an alert within that 7-day window. So pretty substantial difference in terms of the likelihood that cows would have or not have alerts, depending on whether they were affected by metritis only or if they were affected by metritis and another health disorder. Same case for mastitis, but in this case, it's a little bit more related to severity of the type of case of mastitis. Overall, a little bit less than 60% of the cows did have alert, but a pretty substantial statistically significant difference between cows with more severe cases, what we typically call toxic cases of mastitis, such as, for example, cases associated with E. coli versus more mild chronic cases of mastitis that caused less of a change in cow behavior. In those cases, it was less than 50% of the cows with health alerts. So again, the point is that the more severely affected the cow was, the more likely was that cows would have a health alert from this particular system. More recently, we ran another study at a commercial farm in which we use, again, these health ID alerts. We also use milk production as another type of alert, so drops in milk production in relationship to clinical diagnosis. And we observed in that study that about 84% of cows did have one automated health monitoring alert within a 7-day window before or after clinical diagnosis. And here you can appreciate how the vast majority of the alerts were either on the day of or a day before, with a smaller proportion up to 7 days before, and a relatively small proportion on the days after. But about almost 85% of the cows did have alerts either from the health ID score or from the milk deviation, so the milk production rate, and it was a little bit over half from milk as compared to health ID score. But one important concept that I want to highlight, and this will come back later as we go on to discuss practical integration, is recognize how 15% of the cows did not have alerts from health ID score or from milk deviation. So not all cows did have alert, just like we saw in the previous experiment. A vast majority of them did, but not all of them had alerts. And to the last question, so what happens when we implement these type of strategies that integrate data from the systems on herd performance? I'm going to briefly show you results from a study. This is a randomized controlled trial that we ran in which we had half of the cows at a commercial farm be in what we call a high-intensity clinical examination program. So looking at cows very intensively for the first 10 days in milk. So from 3 to 10 days in milk, clinical examination mandatory for every single cow in the herd, plus the use of milk deviations, plus visual observation. So pretty intense in terms of what we were doing to identify cows with health disorders. Thereafter, until cows left the fresh pen, we use daily meal weights and visual observation as the main method to identify cows. But notice that here we did not use what we use in the alternative. So the strategy in which we tried to use as much as possible. So the idea was to use primarily automated health monitoring alerts. So for the other strategy, we tried to use health ID scores, changes in daily meal weight, so daily meal weight deviations as the only method, as the primary method to decide which cows needed clinical examination. So this idea that instead of running every cow through clinical examination, at least in the first 10 days in milk, we would only look at those cows that had these automated health alerts. Of course, we did use visual observation as our safety net because we knew that we would not identify all cows. And because of that, we had visual observation. And I'll tell you in a moment what we have learned from having visual observation included. But again, the main difference is what we use to sort cows for clinical examination. We have a lot of data from this trial. I'll just show you in these 4 panels very quickly the most critical data. So what we learned in terms of the ability to identify cows with health disorders is that we detected either the same or slightly smaller proportion of cows with health disorders when we use automated health monitoring alerts. I want to remind you of how intense the alternative, so the high intensity clinical monitoring strategy was, and that has important implications for these results. But what we observed was about a 4 percentage point difference, so 4% less cows detected with clinical health disorders, which is about a difference of 30% in the risk of being detected with health disorders. This was the period at which cows were at the greatest risk of being detected by alerts. There was the whole period and the period before that I'm not going to expand now. If you have questions, I'm happy to answer. But this is when cows were supposed to be detected by the automated technology, and that's the difference that we observed. So yes, there was a difference, right? But still a lot of the cows that probably needed attention were detected. And that is what we conclude by looking at herd performance outcomes. So we look at the percentage of cows that were sold or died within the first 60 and 150 days in milk. We observe no significant differences. So the way they should be thinking about this is, well, if there were a lot of cows that were sick and were not detected by the automated monitoring strategy, then those cows would be more likely to be sold or died. That was not the case. You would also expect that if there were enough cows that were not detected and needed attention, there would be differences in milk production. We did not detect differences in milk production. So within the first 150 days in milk, there was no difference in milk yield for cows managed with the 2 different strategies. And we also look at first service outcomes, and we observed no statistically significant differences between the 2 strategies. So there were no differences in pregnancies per EI or conception rate, days in milk at first insemination, and so on. So our interpretation of data from this experiment, again, is that this type of strategy that tries to identify as many cows with health disorders based on these technologies will do so. We will detect the majority of cows. Visual observation was needed. Again, I showed you the data before. About 15% of the cows did not have automated alerts at all. So those cows had to be detected through visual observation. And at the level of herd outcomes, implementing this type of strategy did not cause detrimental effects or either positive effects on herd performance. So with all of this data in mind now, I'll share with you the strategy. So how can we integrate these technologies into day-to-day management? But in order to discuss that, I have to bring up what I consider to be a very important aspect of what happens in commercial farms. So if you look at farms in the US or around the world, you can probably see how there is variation in terms of what farms do to identify cows that need attention. So there are some farms that do very little to nothing or have very loosely defined programs to identify cows with health disorders. And then you have the other extreme with farms that have very intensive programs that do a whole lot trying to identify cows with health disorders. I think that in both cases, there are opportunities for the use of these automated health monitoring systems. It's just that the opportunity will be slightly different. Of course, then you have farms that are in between. So you have within these extremes, then you have a whole range of possible scenarios. So it's up to every farm to figure out what's the best situation, what's the best use of these technologies. But in the extreme, so for farms that do very little to nothing, so accurate and timely identification of more cows with health disorders may be helpful. Improved diagnosis, because probably these farms don't have the best methods to diagnose disease, so these technologies could be helpful for that. On the other side of the spectrum, the farms that do a whole lot to identify cows with health disorders, they could reduce labor needs, reduce cow manipulation, and have relatively the same or slightly less level of detection. So the way in which data from these technologies can be used to be integrated into these two type of scenarios. I'm going to start with the first scenario, the one in which the farm makes the least use of this technology. So I want to use a hypothetical list of cows for clinical examination. I'm making the assumption that that's what the farm does, that every morning or afternoon or sometime during the day, there is a list of cows that is generated to look at those that may have health disorders. So in this case, the list is not generated based on data from the automated health monitoring system. We continue to do that based on traditional methods. We do it by days in milk. We do it based on visual observation or some other form of identifying cows that need attention. So in that case, we want to have a list, and please recognize that this is totally hypothetical list of cows. We're going to add at the end of the list here on the right. So these parameters, just as examples, rumination, activity, body temperature, and then the alerts, if the system provides alerts. So we're going to add this information to the list of cows to check, but we are not using this data to decide which cows go on into the list. In this case, this type of strategy will not necessarily help reduce the number of cows to look at. So all that we're going to gain from this is probably just be better at our accuracy of diagnosing health disorders, so making better decisions when we are in front of a cow and we have to decide if the cow is or is not affected by health disorders. So this is probably not, in my opinion, the best use of this type of technology. Then we're going to go to the exact opposite extreme, and that is one in which the list of cows, so the fresh cow list to look at, or the list of cows in general, is generated completely or exclusively based on data from the automated health monitoring system. And in this case, I'll show you through the animation, right? So the idea is that only those cows that have alerts for health checks or from whatever other mechanism that we can use a certain threshold value for one or more of the parameters generated by the systems. So this is depending on the system that the farm has available and how the farm wants to use it. But the point is that we can go from a much longer list of cows to a much shorter or smaller list of cows, where we only look at those ones that, in theory, need attention. So we go from checking a lot of cows that probably don't need attention to focusing only on those cows that need attention. So we hope that this is going to help reduce the number of cows that we're going to look at every day. Here is where it becomes very important, the type of system that we have in place and how accurate that system is to identify cows with health disorders. What I'll tell you again, based on the research that we have generated so far, is that the vast majority of the systems that are out there probably may miss some cows. So the level of confidence that we have to go this way or not depends on how much we trust. It depends on our approach to health monitoring. Do we want to be very stringent and don't miss absolutely any cow that may need attention? Or are we okay with some cows with milder cases of a health disorder not being detected and not being treated? But recognize the fact that some cows may be missed with this strategy. So a compromise or something to do to deal with that and still make really good use of the technology is to, for example, try to use, so this is a timeline of the fresh period. So we're going to try to use as much as we can automated health monitoring system alerts. So this is going to be the main method to screen for cows with health disorders. But then recognizing that not all cows may be identified by the automated system, and recognizing that there are some health disorders, and I'm going to use the example of metritis, but you could probably use this for mastitis or any other health disorder that is not necessarily detected in all cases, and just have like mandatory checks. So add in between maybe at key days in milk or at key time points during the program, add a mandatory check to make sure that those cows that were not detected based on the alerts from the automated health monitoring systems are detected by alternative methods. So that's a way to deal with that. And I'll finish with this just to show you some data, and this is preliminary data that we have generated to see, what's the potential value for management to reduce the number of cows to check. So to go from this long list to this much shorter list. And what we have done is use data from a trial in which this trial that I shall show you, in which we use the automated health monitoring alerts as the primary way to detect cows with health disorders, and extrapolate what would be the reduction in the number of cows to check and the number of man-hours per worker per year. And we estimated that by using the health alerts, there would be a reduction of almost 9,000 clinical examinations just in cows that don't need clinical examination, which would equate to about 425 hours per person running the health monitoring program at a farm. So just to summarize, and I'll stop now for questions. So it is clear that there are alterations to sensor parameters. We have documented that really well. I say data can be messy because I just left you with the take-home messages and I show you some really good looking things, but there is noise in a lot of this data. We are trying to figure out, I'm sure companies are trying to figure this out too, how to deal with that noise and how to still be able to implement these technologies on farm and deal with that noise. So at least some of those that have been evaluated in research of the automated health monitoring systems are able to identify some, probably the vast majority of cows for certain disorders, not so much for others. And the timing of alerts was relatively reasonable. Programs that rely primarily on data from automated health monitoring systems, as the one that I show you, had no major negative or positive consequences or effects on herd performance outcomes. So they seem to be a feasible way of running a health monitoring program for fresh cows. We still have to repeat these experiments and learn a whole lot more about that. but at least the data that we have generated so far, it looks quite promising. There are some potential positive effects on herd management outcomes, such as the number of cows to check. So assuming that we are okay with the level of detection with this type of strategy, if we go on with only looking at cows that in theory need attention based on these alerts, then you can expect that you're going to check fewer cows on any given time period by using these technologies. So with that, I'll leave the repro part for any questions that you may want to have about that, and I'll just go on to thank everyone that makes all this research and work possible, which is mostly my graduate students and my lab personnel, the commercial farms that work with us on these research trials, and of course, the funding agencies that support our research. Thanks a lot, and I'll be happy to answer any questions that you may have.
Right, so thank you, Julio. That was really great. I think we have a few questions in the Q&A, so I'm going to hand that over to Caitlin because I think she can let us know what we have there. So Caitlin, if you want to go ahead and read some of the questions, we can get that portion going.
Okay, great. Yeah, thanks, Julio. That was a wonderful presentation, and you got a few questions from the crowd. I'll start with some that were asked multiple times. The first question is, can you comment on different systems and their efficacy? So neck versus leg versus ear.
Okay, that's a question that probably merits a long answer. So I'll just very briefly say that yes, there are probably differences across the different systems that are today commercially available. I think that in many cases, it probably has to do more with the research that has been done, the longevity of the system in the market, and the R&D that is behind the system, rather than the location. So the one thing that the location of the sensor can affect that is very important is what parameters you can measure. So a leg tag cannot measure rumination time. So from the get-go, if you have a leg tag, you don't have rumination. So you are limited to physical activity and resting behavior, for example, if you have a leg tag. Whereas a neck tag and an ear tag can probably do rumination time, eating behavior, physical activity, and some of them may even add a ear surface temperature. If you have a ruminal boluses today can do rumination, can do physical activity, and can do core body temperature. So the key factor, in my opinion, there is to think about what parameters are available from the sensor system. So you have to start from there. And then what I'll say is that for the parameters for which we have the most and the most reliable data for are rumination time and probably physical activity. So systems that use rumination time and physical activity, or that for sure include rumination time, will probably be more effective than if you don't have rumination time. Eating behavior is another one that we see a very strong correlation with health disorders and with severity of health disorder. It behaves very similarly to rumination time. So if you have rumination and eating behavior, that system may work pretty well. And then the other one is body temperature, right? So infectious health disorders, some of them are typically accompanied by an increase in body temperature. So for those type of disorders, having body temperature may be helpful. because rumination time and eating time may not change as dramatically in those cases. So I would invite people to think a little bit more about the type of parameters that these systems have to offer. And to summarize, I'll say again that rumination time, eating behavior, and physical activity are the ones for which we probably have the most data and the most reliable data that they work. And then body temperature can be useful for identifying disorders that increase body temperature. Milk production, of course, I don't talk a whole lot about milk production, but milk production from parlor sensors is also quite useful. It has a lot of issues, a lot of false positive alerts, and is not as sensitive for some disorders, but it does help as well. But we're talking about a completely different type of sensor system in that case.
Excellent. That was a very helpful answer. So you kind of led right into the next one, which has to do with specificity, false positives. And there's a bit of concern in one of the questions about that increasing labor. So could you comment on the specificity of the automatic monitoring systems that you've reviewed?
Very good. So that's a great question. Thanks for asking that. And just to make sure that everyone understands what's the role of specificity here. So specificity, so when a system or any test has high specificity, it means that it will generate few false positive alerts. So you have to associate a specificity with false positive alerts. Okay, so high specificity, low false positive alerts, low specificity, a lot of false positive alerts. What's the biggest problem of false positive alerts is what the attendee referred to. That is, you have an alert, the system is telling you that the cow may be sick, and you go and you look at the cow and the cow has nothing. So the labor is in going to check those cows. So specificity is quite hard to check for experimental conditions. In the cases in which we have done that with the system that I discussed that uses rumination time and physical activity. We estimated, and we did this by calculating the number of cow days at risk. So every day we look at the entire cows that were at risk of having a false positive alert. And the specificity was actually quite high. It was, if I don't recall wrong, in the 96-97% range. We have done now some additional studies, and it's less than that. So it's closer probably to the high 80s to low 90s. One of the, and again, this would merit a long discussion. One of the issues that we have still today is defining what is a false positive alert, because one of the problems that we could have when we calculate a specificity for the systems is that the system actually may be correct, because if it's telling us 3-4 days earlier than the cow manifests clinical signs, you want to count that as a false positive alert, but it's because the system is seeing something that the cow is not yet expressing. So that is what we in our research are trying to figure out. And I'll share that with you the next time that you guys invite me to give this talk, okay? We are, believe me, it's very complicated. We have been looking at that. In the only case that we were able to estimate that, but I'll take that with a grain of salt. The specificity was really high, but I'm a little bit skeptical of what we have been able to estimate.
Thank you. Okay, can these monitoring systems be used in cows on pasture?
That's a really great question, for which I don't have any data of our own. I'm not aware of peer-reviewed studies that have documented the ability of the systems to identify cows with health disorders in pasture. Of course, I could be missing something myself, so it's just my own knowledge. But I have not seen a lot of data for pasture-based systems. And my guess is yes, one of the challenges with pasture-based systems are some of the factors that add variation to the raw data. Cows in pasture walk a lot more, and they change the amount of time that they walk. They probably have more dramatic changes in their diets because of the forage piece as opposed to cows on TMR. So I think that there's probably more, and for example, for heat detection, that is well documented. For heat detection, it's a little more difficult in some cases for cows on pasture because of that added variation. So all that I can say is that I would expect that there's more variation, and more variation would probably make it more difficult for the systems to be accurate. But I'm not aware of a lot of research data testing alerts or documenting that they can be used the same way that we have tested in confinement systems.
If I may just chime in on that, I've heard that as of this past year, the fastest growing segment for SCR Allflex for their collar sales is in New Zealand, where there's obviously lots of pasture based large dairies. So maybe we'll have more research to come in that area. I know there are some differences in where they need to place the transponders, and so how frequent they get readings on those animals, but it certainly looks like an area of growth.
Yeah, for sure. I mean, it's an area with a lot of potential. Probably one of the main reasons there, I'm not an expert in the New Zealand dairy industry, but heat detection, probably heat detection is one of the main reasons why, these systems are very appealing, but, they bring in the health aspect as well.
Great, thanks. So next one, trying to stay on the health questions prior to going to some repro questions. Is there a large variation in the accuracy of the monitors to detect disorders across farms? And if so, do you think companies would be interested in customizing algorithms to individual farms to improve accuracy?
Very good. Absolutely. I'm sure that there is variation across farms. Farm-specific conditions probably affect the raw data as well as the algorithms. I do know that some companies do have already some mechanisms to adjust for that, but may not necessarily adjust for all of the farm-to-farm variation. Will companies have interest in doing that? I'm sure, they want to provide the best service to their clients, users. So for sure, we are now doing research, multi-herd research studies and trying to figure that out. I can also think of a study that Ricardo Chevel at the University of Florida published a couple of years ago or last year, I think. They actually, they created their own health alerts, and they tested in 2 different herds, and the results were very different. But these were research generated alerts. I mean, it's very specific to what Ricardo's group did, which, I'm sure, it was great. It's just that it was not coming from a company itself, right? But when they tried to go back and look at the results for these same alerts created by them in 2 different farms, the results were quite different.
Oh, interesting. Given that different diseases cause different changes in the systems, do you think that we will be able to make these changes more uniform to get an early alert for diseased cows, regardless of disease category?
Absolutely. That's what everyone is trying to do because that's what we need, right? We need to identify cows that need attention. What does that mean? So cows that need a treatment or cows that need a management intervention. And I highlight that just to say that it's one of the struggles out there, right? It's one of the struggles for companies. It's one of the struggles for researchers trying to figure this out, right? I wish we would not have such difference, right? But everyone is trying to work on that, right? And sometimes, or at least what we are trying to do, I mean, and I don't want to get in the woods of how do we develop these algorithms and so on, but what companies and ourselves are doing is trying to just imagine that someone at the farm sees just one type of alert, just the one thing that tells people, go look at cows. But underneath that, there will be a number of sub alerts or, pieces that are probably better to identify metritis and others to identify mastitis and others for metabolic and digestive disorders, right? And those are making decisions on their own because they are trained. They are very good at detecting those individual disorders. And then those are the ones that feed the general alert, right? Where we tell people, go and look at this number of cows. That's under development, right? I think that's the way of the future. We just still have to get there.
Okay, and I just want to point out, we are at 1:30, but Julio's graciously offered to stay for a few extra minutes to answer the extra questions. If you have to go, thank you so much for joining us. All right, are there automatic health monitoring systems for calves, Julio?
Yes, there are. There are several. There are quite a few that work with the automated feeding systems. I have very little to no experience myself. I know that some of the ones, especially the ear attached ones and some of the intraruminal ones, have been adapted for calves or for young stock, but they are starting to come out now.
Okay, excellent. Have you, let me see here. Have you studied, or are you aware of any studies looking at the frequency of the sensor measurement, if it matters, if it's every second or every minute?
Yeah, no, that's a great question. And that's part of what we're looking at. We are not there yet. It probably does have, I would probably expect that the greatest gains are when you go from 3 times a day, like when cows are red, when they go to or 2 times a day when cows are going to a parlor or somewhere else where they can be measured versus real time. So I think that that's where probably the biggest gain is. If we start thinking about like 1 hour versus 10 minutes, that probably depends on the parameter that you're measuring, how you're using it. So again, it's an area that we are looking at. It's something that is of interest, but I'm not ready to say much about that personally.
All right. And what about for cows in tie stall barns? Do you have any experience in that area, or would you consider them working well on tie stall herds?
I have 0 experience personally working with tie stall barns. All our work has always been done in free stall barns. My expectation would be that parameters that do not depend on physical activity of the cow, that are as effective as when cows are in free stalls, of course, with some variation. I would expect probably rumination behavior or eating behavior is not the same when cows are in tie stalls. Body temperature, it would be probably pretty standard across types of facilities, but physical activity is affected dramatically, right, by cows being tied up in tie stalls. So anything that depends on physical activity. I know that some systems, can use a restlessness, or lying bouts, duration, frequency. Different systems generate different parameters with that. Maybe that's a way to use that data, but it's probably an issue, a challenge for Tysol herds to use physical activity related parameters.
And we'll just continue asking the breadth of what you've used these for. The next question, are you aware of any research on using these systems with sheep, goats, or in the beef cattle industry?
Yes, sure. I'm aware of research. Yes. Can I comment a whole lot? Not. I know, for example, that the beef industry is adopting these systems for heat detection. So heat detection is the one area where they're gaining some popularity for health. I mean, given the fact that in general, under typical management condition, beef cows don't have the same issues with health as lactating, high-producing dairy cows. So I think there's probably a little bit less potential there. And for sheep and goats, I see a lot of research published, but I'm not familiar with farms using them and so on. So I cannot comment a lot on that.
Okay, and there's a question about cost of treatment. Have you tried to look into the cost of treatment if you're looking at a cow who was found to have metritis with a sensor system versus visually detected?
I'm guessing that they are asking about the economic implications of adopting or not adopting the system. There's very little research done in that area. We have done a preliminary analysis for that trial that I showed. And all that I can say is that it does break even and it can be more profitable than traditional strategies that use a lot of labor to find cows with health disorders. And when labor is expensive, which is becoming more and more common, at least for us here in New York, as labor cost and labor availability are a struggle for commercial farms. In the analysis that we have done, provided that the systems perform as well as the one that we evaluated, and then provided that they last about 5 years or so, and within a cost range that is what you find out there for commercial farms, it did break even or was more profitable than the other alternative. But it was comparing to very intensive, so spending a lot of time and effort, a lot of man hours on finding cows with health disorders. If you spend no time today looking for sick cows, then it's going to be more expensive, but then you would have probably a lot more potential to find sick cows that you're not finding today. And that's important, and that's when treating those cows and improving their health, minimizing the risk of culling, improving the repro performance and their productivity will probably pan out very easily. But it depends a whole lot on what the current situation is for the farm.
Great, thank you. Okay, let's go into a couple of repro questions. So can you accurately predict calving time for cows to know when to move her to a calving pen, for example, in a just-in-time system with activity monitoring alone?
We have not published. We have tons of data. It's just that it's so hard to when you have so many cows in your studies, it takes a lot of work, and we are trying to finish that, but we haven't. So I cannot comment from my own research. Others have published some data. There are associations with many of these parameters and calving. Some companies claim that it can be done. I just have not seen data for accuracy on how exactly it's done. What I'll tell you just briefly from the data that we have looked at is highly dependent on the parameter, right? What exactly you're looking at. But just like for diseases, and this is something that everyone will probably understand, not all cows behave the same and present the same physiological changes at calving. And probably the best example are a first lactation cow, so a 2-year-old heifer, and a fourth lactation cow. Anyone who has seen calve, those two types of animals, knows that the changes are a lot more dramatic in a younger cow than an older cow. And the changes are different. And that affects the ability of the systems to detect calving, right? So again, I know that some companies claim that their systems work for that. We don't have data of ourselves ready to share with you guys. Sorry about that.
All right, next repo question. If inseminating heifers, what is the best choice for sensor location? I know you kind of spoke to sensor location before. I'm not sure if you have a different answer for this specific one.
That's a good question. We have not done, I'm not aware of a lot of studies comparing in the same animal different types of sensors. What I'll tell you with heifers, one of the greatest challenges is the fact that they tend to be a whole lot more active than adult cows. There are issues in heifers with false positives, so with lower specificity, especially herds that use prostaglandins to induce estrus. When there is a bunch of heifers in heat, the pen gets revolutionized, and a lot of heifers just come up in heat. Now, in my experience working with commercial farms that have the systems, neck attach and ear attach systems, some of the most popular ones out there, I know that they can be quite effective, and I have examples of farms that do really, really well with neck attach and ear attach sensors for heifers. I have very little experience. I have seen few with leg tags, and even less or none with ruminal boluses.
All right, how about for shot programs? What about letting cows go all the way through a shot program versus using cherry picking if you have technology?
Well, no, that's a great question. And that's what I, had kind of prepared if we had time to discuss. I'll just briefly comment. I'll say, okay, and I want this to be very clear. First, you can design a program that aims to breed as many cows in heat as possible as detected by these automated systems, but that has to be combined with a sync protocol at the end. So you give cows time to be detected in estrus by the automated system, and then synchronization is used, okay? So I'm going to show you quickly now. Let me go to a slide where I have that as an example. So this would be an example of what I'm talking about. So this is letting cows be detected in estrus for 3 weeks, and then they go into the OPSYNC program with progesterone supplementation, basically a CEDAR, okay? So this is what they are asking me. Can you do this? How does this compare to using 100% time AI with a fertility program? So my answer is that this works, okay? But it works if you look at pregnancy rate, so time to pregnancy as the main outcome of interest, okay? So days open or pregnancy rate. When you look at conception rate, when what you're interested the most is conception rate at first breathing, typically, and research has shown that it's always better with time AI, okay? So conception rate, pregnancies per AI, it's better when you use time AI with a program like double OPSYNC. When you use a combination of heat detection and then you use time AI for the rest of the cow, fertility tends to be lower, okay? When you look at all the breathings combined, or when you look at the heat breathings and then the time AI breathings, okay? So from that perspective, time AI is better. But when you look at the preg rate, and here I have the example of the 21-day pregnancy rate from Dairy Comp or if I were to show you survival curves, if I were to show you days open, we have seen in our studies that they can be the same or even slightly better, especially early on, provided that you start breeding cows earlier. So you have to have a shorter voluntary waiting period when you combine heat detection with time AI, okay? That is very, very critical. If you start breeding cows at the same days in milk, it's very likely that the shots program, the fertility program will do better, okay? So it's under this condition, start breeding earlier, have the time AI at the end to make sure that cows are bred within a reasonable amount of days in milk. And then those programs can be as effective as the old time AI programs.
Okay. Great. Thanks for sharing that information. There's one a question that came in off the repro about if there are any robust studies using data that includes milk production associated with sensors in robotic dairy farms.
Yes, again, I think, so is there data? Yes, I mean, there's probably a lot of data out there that shows that cows that are sick have deviations in milk production. I probably don't expect, I mean, to see big differences in terms of what it tells us about cows in robotic milking systems versus non-robotic milking systems. You know, cows that are sick have drops in milk production, so I cannot think of reasons why it would be different, other than maybe the magnitude of the change. And when that is detected, you know, probably is affected by the frequency at which cows are milked in robotic milking systems versus non-robotic milking systems. But I'm not aware of any data comparing non-robotic versus robotic systems. That would be super hard to do. I know of many robotic herds that do use daily meal weights as a, you know, as a parameter to look for sick cows, and I would probably expect that is as effective as it is in non-robotic herds.
Great, thank you. Okay, so Julio, we'll give you this last question, which is a real ringer here. Can we use automated health monitoring systems and heat detection in buffalo? As the question is because they have silent heats. Just for fun, we'd throw it in there.
For fun, yeah, first of all, I have no experience working with buffalo. I just like buffalo mozzarella, that's for sure. But my understanding is that buffalo, as they mentioned, you know, have a lot of silent heats. They just don't express estrus behavior the same way as cows, as cattle. So I would expect that automated systems that use physical activity would not work as well, you know, because just there's nothing to detect. Now, maybe systems that use other parameters such as eating behavior or rumination time or body temperature, maybe those systems would have a little more potential because it does not depend on the animal changing, you know, physical activity, but other behaviors. So, but I also don't know how much buffalo change rumination or eating behavior when they are in estrus. So unfortunately, I don't know. I would expect that those other parameters could compensate for the lack of change in physical activity.
Great. Thank you so much for sharing all of your knowledge on with all these questions and answering and staying with us a little bit longer.
No problem. My pleasure. Thanks a lot for everyone for attending and for the great questions.